Research shows that over 7.8% of people experience endometrial polyps, causing irregular menstrual periods and spotting. You likely have many questions if you found or believe you have this condition. Let us explore what endometrial polyps are and how they are diagnosed. Before we dive into the nitty-gritty, let's take a quick overview of endometrial polyps. Uterine polyps refer to overgrowths of endometrial tissue in the uterus's inner lining. The soft growths can range from as small as a dot to as big as a tennis ball. Experts are still not 100% sure what causes uterine polyps in women. Before conducting lab tests, your healthcare provider will assess your medical history and ask about your symptoms. Most doctors will ask if you experience irregular periods, spotting, bleeding, and the medicines you take. Moreover, they might request a gynecological exam, including a pelvic exam or a pap smear. They will also order the following tests and procedures. Your healthcare provider will use imaging technology to confirm the presence of uterine polyps. The procedure starts with the doctor inserting an ultrasound transducer inside your vagina. The slender, handheld device emits sound waves to create an image of your uterus's inside, allowing the healthcare professional to identify irregularities and thickened tissues. Doctors may use hysterosonography or sonohysterography instead of a transvaginal ultrasound. Here, the healthcare provider inserts a catheter into your vagina to inject salt water. The saline water causes your uterus to expand, thus providing a clearer view of your uterus for an accurate diagnosis. In addition, your doctor will conduct a hysteroscopy involving a flexible, lighted telescope inside your cervix and the uterus. As a result, the healthcare professional will gain an image of your tissue lining and use tools to remove it. Your healthcare provider may recommend an endometrial biopsy to look for cancer cells. Your doctor will use a soft and thin plastic instrument for collecting tissue specimens for lab testing. Once the healthcare professional receives the lab reports, they can detect abnormal cells due to polyps. There's no surefire way to prevent uterine or endometrial polyps. However, doctors recommend losing extra weight to mitigate the risk. In addition, ensure you visit your gynecologist regularly to catch polyps in their early stages. Furthermore, even if you have treatment, get checkups from your healthcare provider to ensure endometrial polyps don't come back. Remember to discuss any new and troubling symptoms you experience. Abnormal bleeding, irregular bleeding, and spotting are signs of endometrial polyps. If you have unusual bleeding or dull abdominal and lower back aches, check with your healthcare provider. We recommend finding a gynecologist near you to discuss, evaluate, and solve your health concerns.